Turning a group practice into an IOP or PHP in Indiana changes your risk the moment you market the program. 10 or fewer versus 11 or more direct service providers, one staffing threshold can change which Indiana certification path you need to analyze. This is a diagnostic guide for Indiana group practice owners deciding whether an IOP or PHP expansion is realistic and where the risk changes. We will cover the certification paths, staffing and leadership gaps, location fit, and the billing questions to resolve before you launch. You already have clinicians, referral relationships, intake habits, and a local reputation, so why is conversion the hard part? An IOP or PHP is not just more therapy hours, it is a structured program. It carries a different licensing analysis, different documentation expectations, different space needs, and a different payer model. Here is where avoidable risk creeps in, advertising an IOP or PHP before the certification question is answered. Before marketing the program, confirm with DMHA or counsel whether your outpatient activity is still ordinary professional practice or has crossed into a certified addiction services provider model. Convert without that analysis, and you risk building the program on avoidable regulatory and payer risk. This conversion is exactly what Behave Health is designed to support. Behave Health's EHR, CRM, and RCM tools are designed to give your operating team a system built for addiction treatment workflows, not generic group practice administration. And Behave Consulting helps organizations think through program model, documentation workflows, payer readiness, and implementation planning. Indiana group practices need 4 areas resolved before marketing an IOP or PHP. Let's walk through each: certification, staffing, location, and billing. Area 1, the certification path. As of May 22, 2026, Indiana's DMHA outpatient certification page covers providers with 10 or fewer direct service providers offering outpatient, IOP, PHP, and withdrawal management services. The regular certification page covers providers with 11 or more direct service providers, and it references accreditation through an approved accrediting body. Both pages point back to 440 IAC 4.4, Indiana's Addiction Treatment Services Provider Certification Rule. Area 2, Staffing and Clinical Leadership. Understand whether your direct service provider count still fits the outpatient certification model, or whether growth pushes the program into the regular certification threshold. Then evaluate whether your team can support addiction treatment documentation, clinical leadership, and supervision expectations beyond ordinary outpatient therapy. The right planning exercise is a tailored review of your program model, level of care, payer mix, and supervision structure, not a staffing matrix copied from an article. Area 3, the location. IOP and PHP services usually depend on group programming, predictable schedules, and confidential movement through the building. Administrative workflows run heavier than individual therapy. Decide whether the current office supports the program or becomes the constraint. Confirm zoning, fire and safety, accessibility, and facility documentation requirements with the local authority, DMHA, and council for your exact address. Area 4, Medicaid and commercial billing. If your practice has mostly billed professional outpatient therapy codes, IOP and PHP billing can require a different operating discipline. Facility enrollment, authorization rules, clinical documentation, utilization review, and claims follow-up may all change once you offer a structured program. IHCP publishes pages for SUD and SMI treatment and behavioral health provider enrollment. Pair them with payer-specific guidance and your own legal and billing advice before relying on the revenue. Underneath all of it sits the strategic question, and it is more specific than, should we open a rehab? Are current clients stepping up from weekly therapy into a level of care you do not offer? Are local hospitals, detox programs, courts, or employers looking for structured outpatient options? Can your clinical team support group-based addiction treatment without weakening the core practice? And would IOP or PHP revenue justify the added certification, billing, supervision, and compliance work? Stop scoping your IOP or PHP conversion on guesswork. Book a demo of addiction treatment-ready EHR, CRM, and RCM workflows at behavehealth.com. Talk with Behave Health before you market the service or commit capital. Book a demo at behavehealth.com.